This is Cleveland Health, the show that tackles health issues that matter most to our neighborhoods. Each month, we bring you powerful stories, expert insights, and real resources to help you and your family live healthier, stronger lives. Join us as we dive into what's shaping the health of Cleveland today so we can all try to make a difference together. Hello, I'm Richard Stewart. Thank you for joining us for Cleveland Health. Here's a look at what we're working on for this episode.
When it comes to mental health, we seem to struggle to be open about the challenges that we may be facing.
From stress and anxiety to depression, trauma, and grief, many Clevelanders are navigating challenges that are not always visible. We discuss the help that's available this Mental Health Awareness Month.
Our health isn't necessarily the same as men's health. It's not the same as children's health, and maybe can't be lumped all together.
Prevention, wellness screenings, and self-care. An important conversation about women's health during National Women's Health Week. And we take a look at public bathrooms, now up and running in Cleveland. May is Mental Health Awareness Month, a time to raise awareness, reduce the stigma, and to remember that mental health is just as important as physical health. I had the opportunity to speak with an expert from MetroHealth's Behavioral Health Department to discuss mental wellness, warning signs, resources, and how we can better support ourselves and one another. Joining me now is Dr. Tiffany Monford from MetroHealth Behavioral Health. Doctor, thank you so much for joining us.
Thank you for having me.
So it's Mental Health Awareness Month, less stigmatized than in previous years. Why is it so important for folks to focus on their mental health?
I think we are very open about talking about our physical health. We'll talk about the need to diet, go check in with your primary care physician. When it comes to mental health, we seem to struggle to be open about the challenges that we may be facing. And yet we also know, especially during this Mental Health Awareness Month, that it gives us this opportunity to shine a light on mental health, on when our health is going well as when we're having challenges. There's this idea of this mind-body connection, and we can't just focus on our physical health. We have to focus on our mental health to be truly well.
When we talk about mental health, what are some common signs that somebody may be struggling but reluctant to talk about it?
I think the first thing is when the person is not being themselves, not being what they're used to being. So when we're beginning to see changes in eating habits, sleeping habits, the changes in the way we think about situations, we're experiencing negative emotions like anger, irritability, anxiety, depression, but it's more intense, more frequent than we're used to experiencing them when we begin to isolate ourselves, when we're making decisions that are outside of what we normally do. So just any of these things that are impacting our functioning and are outside of how we normally operate.
What can family, friends, maybe even coworkers do to support someone who may be struggling with their mental health?
Okay. I usually like to kind of look at 4 words: acknowledge, ask, listen, and know. And so, for one, we want to acknowledge that we're seeing that our family members are functioning differently, that they're not being themselves. Part of that acknowledgement is letting our family members know that we're recognizing this, because interestingly enough, we may think that we're doing well, that we are managing, that nobody notices. And so it may take the people in our lives to point out to us that, hey, I see that you are not yourself. I see the signs that your functioning is impaired. Then we want to ask. We want to ask, how can I support you? Because at times, experiencing mental health challenges can be isolating. There's stigma attached to it. So to be able to tell our family members, I recognize this, I want to support you. And then we want to listen to them. We want to listen to hear what's actually happening, to see how might I be able to assist, what resources may I need to be able to identify for them. And then the biggest thing is to also know those resources, so we really can be able to provide those.
Speaking of resources, where can Clevelanders go if they're suffering?
We can call 988 if we are in crisis. That's the crisis suicide hotline. 411 offers resources within the community. Your primary care physician, your child's pediatrician, those are great places to start because they're usually the gatekeepers. They're usually the people that we know that we go to first. And so because they know that, they're aware of resources for various purposes. You also can ask people in your life. Ask them where they've received services. Definitely seeking just mental health services, medication and talk therapy are important resources. Your NAMI boards, your local mental health boards are also places. And if you're truly in that last moment of experiencing crisis, going to your local emergency room because they can be an immediate help.
What's the most important message you have for an individual who may feel like that they need to seek help but still may be apprehensive?
You deserve to be well. You deserve to not just be physically well, but to be mentally and emotionally well. You deserve to operate at your highest level of functioning, and being able to address your mental health and getting the services you need will get you there.
Well, Dr. Monfort, thank you so much for joining us. We appreciate it.
Of course. Thank you for having me.
As Dr. Monfort said, help is always available. You can dial 988 for the Suicide and Crisis Lifeline, 411 for resources within your community, or you can contact the National Alliance on Mental Illness, or NAMI, at namigreatercleveland.org.
So things like a pap smear is going to look at things like cervical cancer, ovarian cancer, which affects women, and we see those rates going up, and we'd like to get a handle on those.
This National Women's Health Week, we discuss what screenings and routine procedures women should be getting throughout the year. That's next on Cleveland Health.
Hi, I am Bella Spinell, the founder and executive director of Sisters of Economic Action, or SEA. In 2025, SEA proudly served 176 incredible women and managed about $12,000 in funding to support our mission. In July 2025, we applied for our 501c3 status, and we are thrilled to announce that we are officially a 501c3 nonprofit. Between 2022 and 2026, several Black and Latinx women in senior positions were forcibly separated from their jobs in our community. This trend highlighted the urgent need to protect, retain, and advance women of color in leadership. SEA was created to address this problem and ensure women of color have the support, resources, and networks they need to thrive in senior roles. Now, as a 501c3, we are raising capital for our Diasporic Wealth Financial Empowerment Cohort and looking forward to co-working days, workshops, and community building events throughout the year. At SEA, we are committed to creating lasting impact, helping women build wealth, leadership, and influence in their communities. Join us at future events or sistersofecon.org.
Welcome back to Cleveland Health. I'm Richard Stewart. It's a time to encourage women and girls to prioritize their physical, mental, and emotional well-being. National Women's Health Week takes place every year during the month of May. Led by the Department of Health and Human Services, it's a time when health organizations highlight several steps women can take to protect their health. I spoke with the Cleveland Department of Public Health about those steps and more. Joining me now is Lita Wills. She's Commissioner of Health Equity and Social Justice with the Cleveland Department of Public Health. Lita, thanks so much for joining us.
Thanks for having me.
So we're right in the middle of Women's Health Week. Why is it important for the women of Cleveland to prioritize their physical, mental, and emotional health at this time of year?
It's a good question. I think like with any observance, it's really important that we provide some specialized information at specific times throughout the year. Number one, health observances give us specific attention, grabs our attention, certainly makes us pay attention, to be able to know that our health isn't necessarily the same as men's health, it's not the same as children's health, and maybe can't be lumped all together. And there are certain things that we need to have really stick out and get our attention for us to pay attention to them.
What are some of the biggest health concerns among women of Cleveland?
Sure. In Cleveland right now, we get very concerned with people with issues that we would consider getting into chronic health issues like blood pressure if that's too high, diabetes, cardiovascular issues which affect women a lot. And we also, of course, want to make sure that we're looking at specialized things like certain cancer preventions and reproductive health care as well.
Speaking of reproductive health care, when it comes to pregnancy, what are the key things women can do before and during pregnancy to foster the most successful outcomes?
Sure. It's definitely getting support, whether that's through prenatal care and making sure that you're seeing your doctor on time, as early in the pregnancy as you know, and then also making sure that you're getting all the other support that you could possibly get. Sometimes that means having an extra nurse that's visiting you throughout your pregnancy at the home, or a community health worker. And it also is really, really important to decrease stress as much as possible during the pregnancy.
So we know that preventative care can save lives. It's how a lot of people fall through the cracks. What screenings or routine procedures should women get throughout the course of the entire year?
Sure. As you probably know, we look at certain screenings for different cancers, of course, so things like a pap smear is going to look at things like cervical cancer, ovarian cancer, which affects women, and we see those rates going up, and we'd like to get a handle on those. But also those routine things that come with your physical, like checking your blood pressure, getting a cholesterol test for heart issues, getting a blood test that can show how high your sugar levels are. That can get us into being able to prevent some of those deadly conditions that tend to be silent for women.
The Cleveland Department of Public Health has a couple of health clinics. Some people don't know about that. What services are offered at those clinics for women?
Sure. Primarily, we provide reproductive health care through Title X. So things like reproductive health care services like STI checks, pap smears, general checkups, birth control. And then we also make sure that we're providing some other services, like we do immunizations for children, making sure that it's a place that you could get a flu shot, those types of regular routine maintenance as well. Important to get those routine things done because that can lead to referrals if you need help with something else.
So some of the barriers to women getting proper health care are things like childcare, transportation. How do we overcome some of those built-in barriers?
Sure. I think number one, it's important for our employers to prioritize our health. And so if that means making sure that we have standardized sick time in place, making sure that some health centers, including hospitals, can provide help to women in terms of childcare at the facility where you're getting your checkup done, or help with certain things like bus tickets or Lyft rides. We've employed those types of things in a public health setting as well. But it's also really important just to make sure that we're able to take that time to do that routine maintenance for ourselves and pay attention to ourselves, because as women, we're typically caregivers and taking care of everyone else's health and maybe not our own.
That's a great point. What's your main overarching message to the women of Cleveland during this week? What should they really focus in on, in your opinion?
I think it's important to do something annually, right? Like if this is the time, it's a good reminder for you that this may be a good month for you, a good week for you to schedule that, your annual physical, your annual checkup. And we do something called Know Your Numbers, which is a really quick being able to go in and get your blood pressure, cholesterol, and sugar tested. Those are those things that can really help us, and we want to do it every year.
Sounds like great advice. Lita, thank you for joining us.
Of course, thank you for having me.
For National Women's Health Week, the U.S. Department of Health and Human Services put together some tips to improve healthcare visits. The first tip includes being open and honest with your doctor. It's normal to feel uncomfortable sharing information, but this is how your healthcare provider can understand what's going on. Second, write it all down. Don't be afraid to make a list of the topics you want to bring up or information your provider gives you. And third, gather and share your family's health history. This is important and can help your provider more accurately diagnose you. For the full list of tips or more information about National Women's Health Week, you can visit womenshealth.gov. The city of Portland, Oregon installed public restrooms nearly 2 decades ago. Now, other cities are following suit. We learn about Cleveland's newly installed public restrooms next.
Do you have a child under 5 in your life? Did you know that talking and reading with them makes a big difference for kindergarten readiness? You can build your home library with free, high-quality books mailed to your home each month from the Literacy Cooperative and Dolly Parton's Imagination Library. There's nothing that beats the power of a free book coming in the mail as a gift for your child that brings joy and gets them excited about books, reading, and learning. If you're expecting a baby, you can sign up when you're filling out the birth certificate paperwork. Or to enroll, text free books to 216-412-9005 or visit literacycooperative.org. Join the thousands of children already enrolled. Let's get children excited about books, reading, and learning.
Hi, I'm Kate Connor-Morin, the director of Cleveland 311. One of the great things about Clevelanders is that we take pride in our city. Letting the city know about problems is one simple way to look out for your neighborhood. When you see something that needs attention, for example, a pothole, a missed trash pickup, graffiti in a city park, or problems with a building in your neighborhood, there's one easy number to remember. 311 is your connection to city services, the City of Cleveland's central, non-emergency hotline and website that provides easy access to city services and information. Whether you live here, work here, or are just visiting, our goal is to make it easier for you to report non-emergency issues either online or by phone. You can dial 311 or visit us online at clevelandohio.gov/311, and we'll make sure your request gets on the right path. If you submit your request online, you can create an account and track the status of your requests. This is your city, and with 311, you can help make Cleveland better for all of us.
Welcome back to Cleveland Health. Cleveland has something it's never had before: public bathrooms. The outdoor single-unit public restrooms should benefit the unhoused individuals as well as the general public. I spoke with the city about the new addition. Joining me now is Alex Nichols. She's Director of Parks and Recreation for the City of Cleveland. Alex, thank you for joining us.
Thank you. I'm pleased to be here today.
So why is it important for the city to invest in this type of infrastructure now in terms of the public bathrooms?
You know, it's really important. The whole concept of the Portland Loos arose during the pandemic. When everything shut down, a lot of municipalities, both large and small, were struggling with the unhoused population and where would they use the restroom. And so it's really important that we have public restroom access for all of our community, including the unhoused.
Let's talk about the design. These units are designed with safety and durability features, including anti-graffiti surfaces and open-air security grading. What makes this model different than traditional public restrooms?
You know, it's interesting because the City of Cleveland actually has a whole fleet, I will call, of portable restrooms that we use. But portable restrooms can be expensive to maintain, they can be a bit of a challenge, they can be damaged more easily. This is a very durable product that the city has now that we can use as a restroom. It does include automated locking mechanisms. It does have overrides in the event of an emergency for somebody who may be on the inside. And I think most importantly, they're meant to weather the harsh Northeast Ohio winters.
Which is hard to do.
Even for humans.
So the first locations include Canal Basin Park and Perk Plaza. How did you select those initial locations?
So the restroom locations, as I mentioned earlier, this whole project started during the pandemic. And during that time, the city looked at data relating to where some of the unhoused population was congregating and where we thought it would be important for us to have restrooms. From a safety perspective, we wanted something that was highly visible. We wanted to have something that was easy to clean and easy to access. And so those two locations just made a lot of sense for the first locations.
So public restrooms are viewed both as a public health issue and a quality of life issue. How do these new facilities support residents, visitors, and people who are using these public spaces?
Absolutely. You know, when we think about how we're going to support the community, both tourists, both residents, anyone who's in our town, access to public restrooms is important. And when we think about park spaces, when we think about spaces located near businesses, businesses oftentimes want customers to use their restrooms. And having publicly available restrooms is really important. Think about a family with a small child and the child has to use the restroom all of a sudden. Being in a park, having quick access to a bathroom just makes a lot of sense.
So you're conducting a soft launch before fully opening. What's that look like?
Yes, so a soft launch really means we want to test the electrical systems, the mechanical systems. We want people to use the restrooms, make sure that there's no problems with the operation. We want to align cleaning process to make sure that they stay in good condition. So really doing a soft launch gives us an opportunity to test these new amenities in the community before we really fully announce what's going on.
So maintenance and safety are two key issues that come to mind when it comes to public restrooms. What's being done on that front to ensure that these places are not only safe, but well maintained?
Absolutely. So currently we're in negotiations with Downtown Cleveland Inc. They help maintain the public square and plaza spaces. So we're working with them on an agreement so that they can help maintain them using their staff, their resources. Certainly we have a parks team. We're stretched a little thin most of the year. In the summertime we have seasonal employees that we bring on, so we're going to maintain them for the time being until we can work out the details of an agreement with Downtown Cleveland Inc.
So if these initial installations are successful, what's the plan for expansion and new locations going forward?
So ideally these are going to be successful. People are going to really be pleased and happy with what we see. Thinking about Cleveland as a livable city, we'll certainly consider expansion into other locations throughout the city. We will probably look at places where there's a lot of people congregating, where we might have tourists visiting from. And so we don't have any finite plans on future exploration or future additions to this, but on the other hand, I think it's really something that we're going to be very mindful of.
Well, it sounds exciting. Thank you so much for joining us.
Yeah, thank you. I appreciate you having me today.
Absolutely. Thank you for watching Cleveland Health. And remember, we'd like to hear from you. Your experience matters. You can share your personal health journey and the tools or programs that have made a difference in your life. Contact us at clevelandhealth.org. If you're interested in having your story covered on TV20's Cleveland Health, email us at tv20@clevelandohio.gov. That's it for this edition of Cleveland Health on TV20. Thank you for watching. We hope that you learned something that can help you or a loved one live a happier, healthier life. I'm Richard Stewart. We'll see you next time.